We're here today to talk about patient safety, what it means in an African context and how to improve it. WHO defines patient safety as the avoidance, prevention, and amelioration of adverse outcomes or injuries stemming from the processes of care. We must talk about adverse events and injuries because while making efforts to cure our patients, we can unintentionally cause harm. We can make lapses when we are tired or in a hurry, or when we don't pay attention to detail. I am a surgeon. Please listen to what my colleagues think patient safety is.
Before we treat any patient, we should draw a lesson from the doctor's Hippocratic Oath, which states, do no harm in the first place. If we are to treat a patient, we ought to create suitable conditions for best practice in healthcare provision. Never should a patient develop one illness while trying to treat another.
My hospital, just like all health facilities, aim at providing health care in a timely manner with very good quality. However, that provision does not come without error. So the concept of patient safety was born to make sure that that error is eliminated. And there are two arms to it, to look at the system of delivery as well as the best practices among health cares.
Infections are one of the most frequent and serious adverse outcomes of surgery. Their frequency ranges from 2 to 15% in general surgery in high-income countries, but in low and middle-income countries, it can rise up to more than 30% in general surgery and 24% in obstetrics and pediatric surgery. Surgery-associated infections affect patient safety because they lead to an increase in the length of hospital stay of between 4 and 7 days. Infected patients are twice as likely to die, twice as likely to spend time in an intensive care unit, and 5 times more likely to be readmitted after discharge. Lack of prevention of these infections is not because of the cost, but because of poor systems. For instance, antibiotics are given perioperatively in both high-income and low-income countries, but in both they're often administered too early, too late, or erratically, or the wrong and often more expensive antibiotic or doses given. Simple methods such as optimal surgical hand hygiene or correct antibiotic prophylaxis can be used to limit this risk. It has been demonstrated that these are much better implemented and strengthened if a strong patient safety culture and teamwork are developed in the surgical unit. There is a science that underpins improving patient safety. It is a science that unfortunately many of us as clinicians are not taught. But there is a great history of very sound theories. We simplify this in this program to 4 key principles. Safety is a property of the system. We recognize that lack of safety mainly comes from malfunctioning systems that derive from poor state of infrastructure and equipment, unreliable supplies and quality of medications, shortcomings in organizational management and infection control, and many other factors. Secondly, we need to recognize some very simple principles in designing safe systems. There are factors that make it difficult to fix. A lack of resources for buying sophisticated technology, having quality check systems to prevent errors, but we can identify simple ways of improving or designing our systems. One example can be organizing the operating room so that all items needed during an operation, as well as those for intervening in any emergency or complication, are prepared and stored on carts and cabinets. This will stop frequent back and forth trips from the operating room with frequent opening of doors and chaotic situations that may ensue, as well as time loss in the event of an emergency. Designing safe systems doesn't just apply to our technical work, it also applies to our teamwork. We can improve our way of working together, supporting each other, reducing negative sides of a hierarchical system, for example. We want you to understand the fact that teams are enabled to make wiser decisions when they gather diverse and independent input. That is why it is so important to involve patients, their families, and the nurses, so that the whole care team is able to gather and process their insights.
There's a lot written in textbooks about the science of teamwork, but a lot of this really simplifies just 2 things. Number 1, teams make good decisions when they have a mixture of independent inputs. And number 2, teams make good decisions when they have a balance of different kinds of thinking. They speak about straight line and creative thinking. One very useful approach is to organize all the activities into a standard checklist and that are all needed in a particular order before the start of each operation. This is not new to medicine or to other professions for that matter. If you take the example from aviation, pilots have to check and tick a checklist each time before they take off with their passengers. And this is because, like surgeons, once they have started, they are engaged in a very difficult and very dangerous activity. And the lives of those very passengers are in their hands.
On January the 13th, 1982, in Washington, D.C., Air Florida Flight 90 was prepared to depart. While the co-pilot repeatedly expressed the concerns about icy wings, the pilot ignored 7 different warnings. The plane went down in the icy Potomac River. The National Transportation Safety Board conducted a post-crash study and found that the airline industry had a serious hierarchy culture, in which many pilots did not value what a co-pilot had to say, and thus they ignored them. In medicine, we also have a hierarchical system that needs to change. This module will explore how we can improve and understand the science of safety by understanding how each system is designed to achieve the exact result that it gets. System-level factors that impact patient safety include characteristics of the patient, of the providers, of the care team, and the work environment, as well as institutional and external pressures. Team-level characteristics seem to be critically important. In healthcare, the majority of events that cause serious harm to patients occur because of communication errors. A careful and honest review of these factors will enhance patient safety. To understand these concepts through this program, you will start from your local reality after responding to a safety attitude questionnaire. By analyzing and discussing the results, you will have the opportunity to understand what the local perceptions and factors that influence safety in your surgical unit are.
In healthcare, we have to make similar checks that are independent, reliable, and impossible to ignore. And these are for the safety of the patient, because we can all make mistakes at any time. So thirdly, let's talk about learning from problems and mistakes. As healthcare professionals, we're really good at going out and solving problems. That's what we're trained to do. But there's a big difference between solving a problem and learning from that problem. And our goal in this third point is to learn from our mistakes in such a way that those mistakes are unlikely to happen again in the future.
Examining the characteristics of your system is the first step to understanding the factors that put your patients at risk. Just as in the aviation story, we need to elevate the concern of the entire surgical team, the patient and their families to a higher level.
Before we began this program, we were doing surgeries without doing surgical checklists, but now one of the issues that we do is we implement the surgical checklist. And the checklist is just like if you board a plane and the airplane pilots don't ensure that everything is working well, that means your flight is not safe. Likewise, doing surgery without a checklist means the patient is not safe. An example is sometime back we were doing some surgeries in a surgical camp and a young child was made to sleep, but when the child slept, because the patients were very many, it was a surgical camp, we were having a very big volume of patients. We didn't see the child's file, the site of surgery was not marked, and we had to abandon the surgery after anesthesia had been given. Had we used the surgical checklist before that, would have known the site, would have made sure it's the right patient, right operation, right site. That is why I strongly believe the WHO surgical checklist can save lives.
When it comes to standardizing our care, in surgery, we have many standard recommendations to reduce the risk of infection. Examples of this are giving the right antibiotic at the right time, in the right dose, not shaving the patient, the use of the right technique for surgical hand washing with the right product for the right duration, and using the right product for skin disinfection and so on. We understand that our goal in all these things is to treat our patients correctly, all of our patients. But how do we make sure that this happens?
So the unit-based safety programs are aimed at instituting those measures at a unit level. So the surgical unit safety ensures that on one arm, the surgical site infections are abolished. On the other side, the other complications that also relate to surgery are eliminated as much as possible. So these errors tend to occur, but we can do something against it. We know that we can provide health without causing harm.
There are a lot of things that can be done. It's just a matter of finding out what is most feasible and most sustainable so that it can continue to be done once it's proven that these things do actually help.
As long as they are able to see the benefits, it's easy to engage them and make sure that it's sustainable.
Our key words, finally, for this project should be patient safety, reducing harm, feasibility, real-life implementation, cost-effectiveness for your hospital overall.
If we are able to score successes in the units that we implement these projects in, we will be able to infect enthusiasm within the places that we work in the countries that we work in, and in the regions. And hopefully this would roll out across Africa. My passion would be to get all our colleagues passionate about reducing the harm that surgical infections cause to the people that we take care of. And so convincing ourselves and our colleagues is the first step.
Okay.